What is dumping syndrome? Dumping syndrome is a condition where food moves too quickly from the stomach into the small intestine. This often occurs in individuals who have had stomach or esophageal surgery. What surgeries can lead to dumping syndrome? There are several surgeries that can lead to dumping syndrome. Gastric bypass. This is a weight loss surgery. Gastrectomy. This is a surgery to remove part or all of the stomach. Esophagectomy. This is a surgery to remove part or all of the esophagus. Pyloroplasty. This is a procedure to widen the valve connecting the stomach to the small intestine. Other surgical procedures. These include surgeries to treat conditions like stomach ulcers, GERD, or a hiatal hernia. It's important to note that, on rare occasions, dumping syndrome can develop without any of these surgeries. What are the symptoms of dumping syndrome? There are two types of dumping syndrome symptoms. Early dumping syndrome symptoms, 15 to 30 minutes post-meal. There is nausea and vomiting, an overly full or bloated feeling, abdominal cramps, diarrhea, dizziness or lightheadedness, rapid heartbeat, flushing, which means hot, red skin on the face, neck, or upper chest, headache, sweating, and rumbling noises from the abdomen. Late dumping syndrome symptoms, a few hours post-meal. There is sweating, flushing, dizziness or lightheadedness, weakness, rapid heartbeat. How is dumping syndrome diagnosed? To diagnose dumping syndrome, your doctor may use several tests. Mixed meal test. In this test, you will consume a specific food and have your blood sampled to measure your body's response. Gastric emptying test. This imaging test tracks the rate at which food leaves your stomach using a small amount of radioactive tracer in your meal. Upper endoscopy. This procedure uses a flexible tube with a camera to examine the esophagus, stomach, and small intestine. Treatment for dumping syndrome. Early dumping syndrome. Symptoms typically improve on their own within 3 months. In the meantime, dietary adjustments can help manage symptoms. If symptoms persist, medication. Your doctor may prescribe medication to control diarrhea. Surgery. In rare cases, another surgery may be required depending on the underlying cause of the dumping syndrome. Self-management strategies. Dietary adjustments. Eat smaller, more frequent meals. Instead of 3 large meals, it is better to eat small portions every 2 to 3 hours. Eat slowly and chew thoroughly. Take your time to eat and chew food thoroughly. Modify your diet. Increase consumption of vegetables, lean proteins such as chicken, fish, eggs, beans, nuts, and soy. High fiber and complex carbohydrate foods like whole grain bread, unsweetened cereals, wheat pasta, brown rice, and barley. Foods with soluble fiber, such as fruits, oats, barley, beans, and peas. Foods rich in protein and healthy fats, like broiled salmon with skin, and adding small amounts of butter or oil. Lactose-free dairy products such as lactose-free milk and hard-aged cheese. Avoid foods high in simple sugars like honey, candy, sugary drinks, cookies, and cakes. Canned fruits with added sugar or syrup. Dried fruits. Juices high in fructose corn syrup or labeled as concentrated. Fizzy or sugar-sweetened drinks. Fried foods. Hot dogs and other heavily processed meats. Alcohol. Dairy products containing lactose. Limit. Gas-inducing foods such as beans and broccoli. Caffeinated beverages. Fluid intake. It is important to stay hydrated throughout the day, but avoid drinking fluids during meals. Wait about 30 minutes after eating before drinking. Support groups. Joining support groups can help you connect with others who have experience with dumping syndrome, providing emotional support and practical advice. Preventing dumping syndrome. The best prevention method involves adjusting your eating habits after surgery to minimize the risk of dumping syndrome. When to contact your doctor. You should seek medical advice if your symptoms do not improve or worsen despite dietary changes. You experience rapid and significant weight loss. Eating becomes increasingly difficult. You feel anxious or depressed due to your condition. By managing your diet and staying informed, you can effectively manage and prevent the symptoms of dumping syndrome. Please subscribe to the channel for more content. Thank you.